Bismillahirrahmanirrahim. Assalamu alaikum. My name is Rida Akil. I am a student of MS Chemistry in University of Management and Technology, Sialkot. I have made this presentation under the supervision of Dr. Hamad Majid, the HOD of Department of Chemistry in UMT, Sialkot. Today I am going to explain everything about brain surgery, the latest advancements, workings, machines, everything that is used in the field of brain surgery. Here is the list of my contents. First of all, I'll give a brief info about the small intro regarding brain surgery. After that, the history of brain surgery, modern surgical instruments, and then there are a few techniques that are used in brain surgery. These include brain mapping, laser interstitial thermal therapy, electrophysiological monitoring, implantable devices, neuromodulation, and many more. First of all is brain surgery. What is brain surgery and what is the purpose of brain surgery? Brain surgery, which is commonly known as neurosurgery, is concerned with the surgical treatment of disorders which affect any portion of the nervous system. In simple words, any disorder or improper function in our nervous system can lead a person to brain surgery. Nervous system include brain, spinal cord, and peripheral nervous system, and many parts related to nervous system. Any disorder in those areas can lead us to the brain surgery. The surgical treatment of brain tumor plays a critical role in achieving optimal patient outcomes. Over the years, significant advancements in surgical strategies and innovations in neurosurgery have transformed the field. Surgical strategies for brain recovery have evolved to maximize tumor removal while minimizing the impact on surrounding healthy brain tissue. Over the years, now it is possible to perform the brain surgery with minimum impact on the surrounding healthy brain tissues. A patient gets maximum recovery in very few days regarding the latest advancements and techniques that are used in this field now. Over and over years, the technique of brain surgery is evolving. Many new discoveries are happening in this field, which can lead to a very easy process of brain surgery with minimum time for recovery and minimum impact on surrounding healthy brain tissues and maximize their person recovery in very short time. We look into the education and context of brain surgery, we can see that in different countries there are different requirements for an individual to legally practice neurosurgery. In most of the countries, a neurosurgeon must requires a minimum of 7 years education to treat a person regarding any brain disorder. To perform brain surgery, it requires minimum of 7 years education. History of tumor removal. In 1879, after locating it via neurological science alone, Scottish surgeon William Meswin performed the first successful brain tumor removal. Meswin was the first person who performed the successful brain tumor removal. On November 25, 1884, a scientist, Bennett, used Mason's technique to locate it, but his technique is far different from Mason's operation, as the Bennett operated on the exposed brain, whereas Mason operated out of the brain via terpination. The Bennett technique was highly risky as it requires proper invasive surgery, highly invasive surgery, which requires a long time for the patient to recover and all that. But Mason operated outside of the brain via a process that is called terpination. Trepanation is a process in which through surgical intervention a hole is drilled into the human skull. Just a small hole, and the infected area where the tumor is arise is removed with the help of surgery. On March 16, 1907, Austrian surgeon Hermann Schauffer became the first to successfully remove a pituitary tumor. Lobotomy. It is a technique that is also known as leucotomy, was a form of psychosurgery. It is a technique that is used to treat a person with mental disorders. A person suffering from mental disorders like hallucinations and all that is treated with a technique that is called lobotomy or leucotomy. History of electrodes in the brain. As we all know that there are different electrodes present in the brain. In 1878, Richard Catton discovered that electrical signals transmitted through an animal's brain. He observed that electrical signals can transmit it to the animal's brain. In 1950, Jos Delgado invented the first electrode that was implanted in an animal's brain, using it to make it run and change direction. The scientist performed experiment on an animal, that is bull. He used it to make it run and change direction. In 1972, the cochlear implant, a neurological prosthetic that allowed deaf people to hear, was marketed for commercial use. 1972, another scientist performed an experiment in which electrode inserted into the human brain through which deaf people can hear. There are many other examples regarding electrodes in brain. Then here are a few modern surgical instruments that are used specifically in the brain surgery. The main advancements in neurosurgery came about as a result of highly crafted tools. The modern surgical instruments include chisels, curettes, dissectors, distractors, elevators, forceps, and many more. You can see them all on the screen. First one technique that is used in brain surgery is brain mapping. Brain mapping is the study of anatomy and function of the brain and spinal cord through the use of imaging. Through this technique, we can study the complete anatomy and function of the nervous system that includes brain and spinal cord. As a result, we get different maps in which the complete function, any disability in the brain, and everything about nervous system is written. If you look through the overview of brain mapping, all neuroimaging is considered part of brain mapping. Neuroimaging is the function through which we can see the proper image of the brain and spinal cord. It is considered a part of brain mapping, but brain mapping can be conceived as a higher form of neuroimaging, producing brain images supplemented by the result of additional data processing or analysis. The maps we get as a result of brain mapping are called connectograms. In 2021, the first connectome that shows how an animal's brain changes through its lifetime was reported. The first connectome that shows how an animal's brain changes throughout its life, like through which stages it goes throughout his life. In 2021, it was discovered. Furthermore, scientists mapped and compared the whole brains of 8 isogenic C. elegans worms, each at a different stage of development. Many examples are given, such as scientists combine electron microscopy and rainbow imaging to show for the first time the development of a mammalian neural circuit. In figure 4, we can see the connectogram. It is like a map which is studied by the scientists which can give the proper information about brain or any disability in brain or spinal cord. Now, what are the instruments used in brain mapping? In brain mapping, different instruments and machines are used to study and understand the structure and function of brain. These include magnetic resonance imaging, which is also known as MRI, magnetoencephalography, MEG, optically pumped magnetometers, OPM, electroencephalography, EEG. First one is magnetic resonance imaging, which is also known as MRI. Magnetic resonance imaging is a non-invasive imaging technique that can be used to do things like map brain structure and detect brain activity. It is a non-invasive imaging technique. Non-invasive means it's not the complete it's not include the complete opening of the brain. It can in this process a patient can heal in very small time. Maximum recovery is possible. It is used to do things like map brain structures and detect brain activity. For example, functional MRI detects changes in blood flow and oxygenation associated with neural activity in the brain that occurs when the person being imaged carried out at a specific task. In figure 5, we can see a person performing MRI. Second one is magnetoencephalography, which is also known as MEG. MEG records the magnetic fields produced by neuronal activity in the brain, providing information about brain functions and mapping brain networks. Magnetoencephalography is a non-invasive brain imaging method allowing neuroscientists and clinicians to view electromagnetic changes resulting from brain activity at the millisecond time scale. In MEG, we can see minor details about any patient. We can see the brain activity at every millisecond time scale. What changes are detecting in a patient's brain or spinal cord in every very short time, in every second. We can see that through MEG. It is the more advanced form of MEG. After that, electroencephalography, which is also known as EEG. EEG uses electrodes placed on the scalp to record electrical activity in the brain, helping to diagnose and monitor conditions like epilepsy. In EEG, some electrodes are placed on the scalp of a patient through which the electrical activity of the brain is recorded. This technique is used to diagnose conditions like epilepsy and any other trauma. Epilepsy is a condition in which the different patient get different seizures in the brain, like time to time hallucination seizures. These include all in epilepsy. These are treated through the process of EEG. EEG is also a non-invasive method used to measure electrical activity from neurons in the brain. Then optically pumped magnetometers, OPMs. Optically pumped magnetometers constitute our groundbreaking variable imaging system, developed in collaboration with the University of Nottingham. OPMs operate without cooling and can be placed directly on the scalp surface, making this a wearable device. The sensors are small, which increases the spatial resolution at which we can measure brain activity. Our simulations show that the decrease in brain to sensor distance offered by the new OPM sensors will facilitate a five-fold increase in sensitivity and spatial resolution for the typical adult cortex. Then we can see what is the chemistry involved in brain mapping, how chemistry is related to the process of brain mapping. Chemistry plays a significant role in brain mapping techniques as it involves the use of various chemical compounds to monitor and manipulate brain activity. One example is the use of contrast agents in functional magnetic resonance imaging (fMRI) to enhance the visibility of specific brain regions and understand their function. Some contrast agents are used in functional magnetic resonance imaging. It is a type of MRI. Contrast agents include iodide, bromide, etc. Many. These are the chemical compounds that are used to enhance the visibility of specific brain regions and help to try understand their function. Then another example is the use of radio tracers in positron emission tomography (PET), which involve the injection of radioactive chemicals to track the distribution of certain substances in the brain. The radioactive chemicals include different like carbon, cobalt. These are used to track the distribution of certain substances in the brain. There are many other compounds that are used in brain mapping. This is how chemistry is related to the process of brain mapping. Then there are some limitations of brain mapping also. Some limitations include brain mapping techniques may not have the intricacies of brain function. Some techniques, such as functional magnetic resonance imaging, have limited spatial resolution and cannot accurately pinpoint the exact location of neural activity. Similarly, fMRI and electroencephalography have limited temporal resolution and may not capture rapid changes in brain activity. It is not the most advanced technique of brain surgery. Second one is invasiveness. Some brain mapping techniques, such as invasive electrode recordings or brain stimulation, require surgical procedures and carry certain risk. These invasive techniques are typically used in clinical settings for specific medical purposes, but they are not suitable for large-scale studies or routine clinical use. Then inter-individual variability. The human brain is highly complex and exhibits significant inter-individuality variability. Brain mapping techniques may not fully account for these individual differences. Like every person, brain differ. Like brain anatomy and brain functions are different in every person. Brain mapping is not fully account for individual differences. It does not provide the complete information for every specific individual in this world. This makes it challenging to generalize findings across different individuals or populations. The limited understanding of brain processes. Our current knowledge of how the brain works is still evolving. It's a vast field to study. It's still evolving. While brain mapping can provide valuable insights into certain aspects of brain function, there are many unanswered question processes. Although brain mapping is a very broad field, it can provide us a complete anatomy and function, but there are still many unanswered questions about brain, the disorders, and many more that are not still studied in brain mapping. After that, another technique that is called laser interstitial thermal therapy, also known as LITT. It is a minimal invasive procedure used to treat certain brain conditions such as epilepsy and brain tumors. It involves the use of laser energy to heat and destroy abnormal tissue in the brain. It is a minimally invasive technique. It is not a like complete opening up and all that. It requires minimum time period for a patient to recover. It is used to treat certain brain conditions, mainly epilepsy and brain tumors. In this process, the laser can be directed to a defined area in the brain. The area that is detected, the laser is infected into that area of the brain using a thin fiber that is guided to the tumor tissue. The laser transmits energy and as a result heats up the tissue surrounding the tip of the laser fiber. High temperature can cause rapid, irreversible tissue damage, in this case to the brain tumor. Like specific laser is inserted on the infected area of the brain. That heat that is produced through the laser will destroy the specific tissue, the area of tumor on the brain, and as a result, tumor is removed. It's a minimally invasive therapy that uses a thin laser fiber guided with real-time MR imaging to precisely destroy tumor tissue. During the operation, real-time MRI generates a live temperature map of the patient's brain. This allows the surgeon to continually monitor brain tissue temperatures, making sure that laser-induced damage is effectively targeted to the tumor and restricted from the healthy tissue around the tumor. Like during the operation, the live temperature map is showing to the doctor. This confirms that the damage is to the process is going on the infected tumor and not destroying the healthy tissue around the tumor. Because this technique only requires a small incision and hole to guide the laser fiber through, the treatment does not involve a craniotomy and is considered minimally invasive. The procedure typically lasts 3 to 4 hours. Much of it is spent carefully positioning the laser fiber, while the laser treatment itself takes minutes. The process is just of few minutes, but it requires maximum of 3 to 4 hours for recovery. Like in specific surgeries, in normal surgeries, it requires months, weeks, or even years for recovery. But through LITT, a patient can now able to walk after 3 to 4 hours of surgery. It is used to treat different kind of tumors like gliomas and brain metastases. LITT is most effective on tumors that are less than 3 centimeters in diameter and have a spherical shape. Operative principles. If we see to the operative principles of laser interstitial thermal therapy, it is performed stereotactically and generally in an interventional and intraoperative MRI suite while patients are general under anesthesia. Using preoperative imaging, the lesion is targeted, a simple blur hole is created. When required, a needle biopsy may be performed before treatment for definitive tissue diagnosis. How LITT works. It is a minimally invasive procedure used to treat certain brain conditions such as epilepsy and brain tumors. It involves the use of laser energy to heat and destroy abnormal tissue in the brain. During the procedure, a thin laser fiber is inserted into the brain through a small hole in the skull. A small hole is created in the skull through which laser is inserted into the infected area of the brain. The fiber is guided to the targeted area using real-time imaging techniques such as MRI or CT scans. Once in place, the laser emits precise and controlled heat energy which creates a localized increase in temperature. This increase in temperature causes the abnormal tissue to be destroyed while sparing the surrounding healthy tissues. It doesn't affect the healthy tissues in the brain, it just only destroys the specific area of the brain, the area that is affected with the tumor. Overall, LITT has shown promising results in the treatment of various brain conditions. It is much more better than other techniques of tumor removal, as it is less invasive, requires smaller incisions, and can be performed on an outpatient basis in some cases. What are the instruments used in LITT? First of all, MRI machine. Magnetic resonance imaging (MRI) is typically used to guide the placement of laser probe and monitor the treatment in real time. MRI helps ensure accurate targeting and monitoring of the thermal ablation process. Computer workstation. Computer workstation used to control the laser system and monitor the treatment process. It allows the healthcare professional to adjust the laser power, duration, and distribution as needed. Through computer workstation, uh, it is a control that how laser is provided to the patient, its power, its duration, and its distribution as that is needed for a specific patient. It is all done through the use of computer workstation. After that, another instrument that is cooling system is used. It is used to protect surrounding healthy tissues. As when the laser is inserted into the patient, it causes the patient to heat up the specific areas of brain. If the cooling system is used to protect the surrounding healthy tissues and only to destroy the specific area of the brain. The navigation system. In some cases, a navigation system may be used to assist in guiding the laser probe to the precise location. Within the uses preoperative imaging data to create a 3D map, helping the surgeon navigate and target the abnormal tissue accurately. What are the advancements in the field of laser interstitial thermal therapy? These include improved imaging techniques. In imaging technology, such enhanced MRI or real-time operative imaging have allowed for visualization and targeting of abnormal during LITT procedures. Then computer-assisted planning and navigation. Integrated navigation systems using pre-operative imaging data are being utilized to create 3D maps and assist surgeons in accurately navigating to the abnormal tissue. Then closed-loop feedback control. Some advanced LITT systems now incorporate closed-loop feedback control mechanisms, where temperature sensors within the tissue provide continuous feedback to adjust laser power and duration in real time. This ensures optimal thermal energy delivery and helps prevent overtreatment or undertreatment. Finally, the combination therapies. Researchers are exploring the potential of combining LITT with other treatment modalities, such as chemotherapy or immunotherapy. It's used to enhance the effectiveness of the overall treatment strategy. Then there are also some limitations of this technique, as there were some for brain mapping. This technique also has some limitations or disadvantages. First one is size and location restrictions. LITT may not be suitable for tumors located in certain areas of the body or those that are too large in size. LITT is basically mainly used for the tumors that are inserted in the brain. It is not used for the tumors located in certain areas of the body or tumors that are too large in size. It is not applicable for such type of tumors. The limited depth of penetration. The laser energy used in LITT can only penetrate a certain depth, which may limit its effectiveness for deeply situated tumors. LITT can go through only a specific distance into the brain. It cannot go deeply inside the specific part of tumor. So it is not effective for deeply situated tumors. Then inability to visualize tissue changes in real time. Unlike traditional surgical procedures, LITT does not provide real-time visualization of tissue changes. This can make it challenging to ensure accurate target ablation. Risk of complications. As with any medical procedures, there are risks associated with LITT, such as infection, bleeding, damage to surrounding tissues, or neurological effects. Damage to surrounding tissues is very risky process in LITT. As the laser inserted into the brain, there are higher chances to infect the surrounding healthy tissues as the heat of laser is very much. This is performed very carefully to cover only the specific targeted area of the brain. The lack of long-term data. Although LADT has shown promising results in some studies, long-term data on its effectiveness and safety are still limited. And finally, the cost. LADT is a relatively expensive procedure compared to other treatment options, which may limit its availability and affordability for some patients. It's important to consult with a healthcare professional to determine if LITT is appropriate for a specific case, considering individual factors and potential limitations. Adverse effects have been cited to occur in as many as 83% of patients undergoing LITT. Most common complications of LITT include temporary or permanent neurological defects, cerebral edema seizures, and intracranial hemorrhage 0.98 to 14.2%. Also, hemorrhage is thought to result from passage of fiber or stereotactic biopsy. Other less common complications also include hyponatremia, hydrocephalus, headache, malignant cerebral edema, and many more. Catheter misplacement has been quoted as high as 14.2%, but this problem has slightly been reduced as stereotaxis and surgical planning have improved. In a series of 120 patients, mortality occurred in 3 cases. It's all about LITT. The next one technique that is used in brain surgery is electrophysiological monitoring. It refers to the process of recording and analyzing electrical signals in the body, particularly in the brain or nervous system. It involves placing electrodes on the skull or directly on the nerves or muscles to detect and measure electrical activity. It's commonly used electrophysiological monitoring technique. It involves placing electrodes on the scalp and recording the brain's electrical activity. The complete brain electrical activity is recorded in electrophysiological monitoring by inserting the electrodes on the scalp of the person. This can help identify abnormal brain patterns such as those associated with seizures or sleep disorders, etc. Overall, electrophysiological monitoring provides valuable information about the functioning of the nervous system and can aid in the diagnosis, treatment, and management of various neurological and neuromuscular conditions. Working. If you see to the working of EEG, we can see that EEG involves placing electrodes on the scalp to detect and record the electrical activity produced by the brain. This non invasive method can provide information about brain function and detect abnormalities such as epileptic seizures. Intracranial monitoring, on the other hand, it is the reverse of EEG. It involves placing electrodes directly or inside of the brain. But in EEG, we insert the electrodes outside of the brain, which is minimal invasive. The invasive technique, that is intracranial monitoring, provides more precise and detailed information about brain activity, particularly in cases where EEG may not be sufficient. It's commonly used in patients with epilepsy who are being evaluated for potential surgical treatment options. What are the advancements in the field of EEG? First one is high density electroencephalography. This technique uses a greater number of electrodes to capture more precise and detailed brain activity patterns. It allows for better localization of brain functions and improved assessment of brain disorders. Then functional magnetic resonance imaging. It's a type of also MRI, fMRI. While not directly an electrophysiological technique, fMRI is often combined with EEG to provide a comprehensive understanding of brain activity and functional connectivity. This combination allows researchers and clinicians to study brain networks and identify abnormal brain activity. Then magnetoencephalography, MEG. MEG measures the magnetic fields generated by the electrical activity of neurons in the brain. It provides high spatial and temporal resolution, allowing for precise mapping of brain activity and identification of abnormal electric patterns. After that, intracranial electrocorticography. This technique involves placing electrodes directly on the surface of the brain to record electrical activity. This technique provides a more localized and detailed view of brain activity compared to non-invasive techniques like EEG. This is the advancement in which we can get the more detailed view of brain activity. In EEG, we also get the view of brain activity, how is brain acting. But in this intracranial electrocorticography, we can see the even more localized and detailed view of brain activity as compared to EEG. The closed loop neuromodulation systems. These systems involve real-time monitoring of brain activity and the delivering of targeted electrical stimulation to specific brain regions. They have shown promise in treating neurological conditions such as epilepsy, Parkinson's disease, and depression. Now, wearable and implantable devices. Advances in technology have led to the development of portable EEG devices and implantable neurostimulators. These devices enable long-term monitoring of brain activity and also targeted stimulation, improving diagnosis and treatment of neurological disorders. Instruments used in EEG. Some of the instruments that are used in electrophysiological monitoring in electroencephalography include electroencephalography machine. These devices measure and record electrical activity in the brain using electrodes placed on the scalp. They are commonly used to diagnose conditions such as epilepsy, sleep disorders, and brain injuries, etc. The electromyography machines, EMG. EMG measures and records the electrical activity of muscles and nerves. This can help to diagnose conditions such as muscle disorders, nerve damage, and motor neuron diseases, and many more. Then ECG machines. ECG measures and records the electrical activity of the heart. This is a technique that is applicable if a person is affected to a heart disease or heart attack or minimum any symptoms of heart attack. In this case, we perform the ECG of the specific patient to check the activity of the heart. It is used to diagnose and monitor conditions such as heart rhythm abnormalities, heart attacks, and heart diseases. Then evoked potential machines. These devices measure the electrical responses of the brain and nervous system to specific stimuli such as visual or auditory signals. This can be used to diagnose conditions such as multiple sclerosis, optic neuritis, and peripheral neuropathy. The nerve conduction velocity machines (NCV). It measures how quickly electrical signals travel along nerves. It can detect then that how quickly an electrical signal can travel through the nerves. It is used to diagnose conditions such as carpal tunnel syndrome, peripheral neuropathy, and spinal cord injuries. Then transcranial magnetic stimulation machines (TMS). TMS uses magnetic fields to stimulate specific areas of the brain. It is used for various purposes, including treating depression, studying brain function, and mapping the motor cortex. And finally, the intraoperative monitoring system (IOM) system. The system monitors the electrical activity of the brain, spinal cord, and nerves during surgery. They help prevent damage to critical structures and ensure the preservation of neurological functions. Then there are a few limitations regarding electroencephalography. These include invasive nature. Electrophysiological monitoring often requires the insertion of electrodes or probes into the body, which can be invasive and carry certain risks such as infection or tissue damage, and many more. Then interpretation challenges. Analyzing and interpreting the data obtained from electrophysiological monitoring can be complex and requires expertise. Differentiating normal activity from abnormal signals can be challenging, especially in cases where baseline measurements are not available. Sensitivity to interference includes electrophysiological signals can be infected by the area sources by various sources of interference such as electromagnetic fields or movement artifacts. This can lead to inaccurate or noisy data. This makes it difficult to interpret the results accurately. Then there are few limitations in spatial resolution. Depending on the technique that are we using, electrophysiological monitoring may have limitations in spatial resolution. For example, electroencephalography provides a global overview of brain activity but lacks precise localization. Limited access to deep structures. Some areas of the body, such as deep brain structures, may be challenging to access for direct. This limitation can restrict the ability to monitor specific regions of interest accurately. Inability to provide real time feedback. While electrophysiological monitoring can provide valuable information about neural activity, it doesn't always allow for immediate intervention or real time feedback. Surgeons may need to rely on their interpretation of data post operatively rather than making immediate adjustments during surgery. And finally, the cost and availability. Some specialized electrophysiological monitoring techniques or devices may be costly and require specific expertise, limiting their availability in certain healthcare settings. It's also important to note that advancements in technology and research continue to address some of these limitations, aiming to improve the accuracy, accessibility, and usefulness of the electrophysiological monitoring in various clinical situations. This is all about it. The fourth one technique in brain surgery is implantable devices. Neural implants are used for deep brain stimulation, vagus nerve stimulation, and MIPE controlled prosthesis. It sounds like a fiction, but a neural implant could many years from now read and edit a person's thought. It sounds like a sounds like a story, like a fiction, but it is possible that it is.
The science is much evolved now that through the use of neural implant, we can hear or read a person's thought. What is the specific person is thinking? We can get to know about a person's thought through the use of neural implants. Neural implants are already being used to treat disease, rehabilitate the body after injury, improve memory, communicate with prosthetic limbs, and many more. Purpose of implantable devices in brain. Neural implants can treat neurological disorders including Parkinson's disease, epilepsy, chronic pain, etc. They can also help individuals who have suffered a spinal cord injury or amputation to control prosthetic devices such as robotic arms or legs. Understanding of neural implants. Neural implants are electronic devices surgically implanted to the brain to provide therapeutic or prosthetic functions. They are designed to interact with the brain's neural activity by receiving input from the brain or sending output to it. These devices typically consist of a set of electrodes that are attached to specific brain regions and a control unit which processes the signals received from the electrodes. The electrodes in neural plants can be used to either stimulate or record neural activity. Stimulating electrodes send electrical impulses to the brain, which can be used to treat conditions like Parkinson's disease or epilepsy. How neural implants are inserted into the brain. Implantable devices can be inserted into the brain through a surgical procedure known as brain surgery or neurosurgery. A common approach that is called stereotactic surgery involves creating a small hole in the skull and using specialized tools to navigate to the targeted area of the brain. This procedure can be performed manually or with the assistance of advanced imaging techniques such as magnetic resonance imaging, MRI, or CT scans. Once the targeted area is reached, the implantable device, such as deep brain stimulation electrode or a neural implant, is carefully inserted into the brain tissue. These devices are designed to interface with the neurons in the brain and can provide therapeutic benefits for conditions like Parkinson's disease, epilepsy, or paralysis. The benefits of neural implants. It has many benefits, wide range of benefits for individuals suffering from neurological disorders. These include improved quality of life. Neural implants can significantly improve the quality of life for individuals that are suffering from neurological disorders such as chronic pain or epilepsy, etc. By controlling or alleviating the symptoms of these conditions, individuals can experience greater independence, mobility, and overall well being. Enhanced cognitive abilities. Neural implants have also the potential to enhance cognitive abilities, such as memory and attention. By stimulating specific regions of the brain, neural implants can help to improve cognitive functions, particularly in individuals that are suffering from conditions such as Alzheimer's diseases or traumatic brain injury. These are all treated through the use of neural implants. Then, prosthetic control. Neural implants can also be used to control prosthetic devices such as robotic arms or legs. By directly interfacing with the brain, these devices can be controlled with greater precision and accuracy, providing greater functionality and independence for individuals and amputations or spinal cord injuries. Then, in the area of research, it has specific benefits. Neural implants can also be used for research purposes, providing insights into the working of the brain and the underlying mechanism of neurological disorder. By recording the neural activity, researchers can gain a better understanding of how the brain functions and develop new treatments and therapies for a wide range of neurological conditions. Then, what are the challenges that a specific person in the field are facing regarding the use of neural implants? The first one is invasive nature. Neural implants require surgery to be implanted in the brain, which carries inherent risk such as infection, bleeding, and damage to the brain tissue. Additionally, the presence of a foreign object in the brain can cause inflammation and scarring, which can be affecting the long-term efficacy of the implant. Technical limitations. Neural implants require advanced technical expertise to develop and maintain. Many technical challenges still need to be overcome to make these devices practical and effective. For example, developing algorithms that can accurately interpret the signals produced by the brain is a highly complex task that requires significant computational resources. After that, cost is a big challenge that we're facing. Neural implants can be costly and are often not covered by insurance. This can limit access to this technology for individuals who cannot afford the cost of the implant. Then, ethical considerations. Using neural implants raises several ethical considerations, particularly concerning informed consent, privacy, and the potential for unintended consequences. For example, there may be concerns about using neural implants for enhancements or otherwise incorrectly. The last one is long term durability. Neural implants must be able to function effectively for extended periods, which can be challenging given the harsh environment of the brain. The long term durability of these devices is an area of active research and development, with ongoing efforts to develop materials and designs that can withstand with the stresses of the brain. While the challenges associated with neural implants are significant, ongoing research and development in this field are helping to overcome many of these obstacles. The instruments used in this technique include stereotactic frame, burr, burr hole treffin, electrode placement tools, microscope, electrocautery, structures and clips, drill, microforceps and microscissors, sterile drapes and scalpels, imaging devices. Stereotactic frame is a device that is used to precisely target specific areas of brain during surgery. Burr-hole treffin, it is a surgical instrument that is used to create small holes in the skull for access to the brain. The electrode placement tools, these instruments are used to guide the placement of electrodes or leads into the brain tissue. Then microscope is used to provide magnification and clarity during the surgery. Electrocautery is an instrument that is used to heat to coagulate or cut tissue during the procedure. Structures and clips are used to close devices in place. Then drill. A surgical drill may be used to create larger openings in the skull if necessary. Microforceps and microscissors. These delicate instruments are used for precise dissection and manipulation of tissue. Sterile drapes and scalpels and imaging devices, like imaging tools like MRI or CT scanners, may be used before or during the surgery to help guide the implantation process. Companies operating in the neural implant size. Several companies are developing neural implants. These include Neuralink, founded by Elon Musk, is focused on developing neural implants that can help to treat a range of neurological conditions such as Parkinson's disease, paralysis, and epilepsy. The company's initial focus is developing a brain machine interface and that enables the individuals to control computers and other devices using their thoughts. After that, BlackRock Microsystems. This develops various implantable devices for neuroscience research and clinical applications. The company's products include brain implants that can be used to record and stimulate neural activity and devices for deep brain stimulation and other therapeutic applications. And Medtronic is a medical device company that produces a wide range of products, including implantable devices for treating chronic pain and epilepsy, etc. The company's deep brain stimulation device is the most widely used for treating movement disorders and other neurological conditions. Synchron is a developing an implantable brain computer interface device that can enable individuals with paralysis to control computers and other devices using their thoughts. The company's technology is currently being tested in clinical trials to eventually make this technology available to individuals with spinal cord injuries and other forms of paralysis. The kernel focuses on developing neural implants for various applications, including medical treatment, research, and cognitive enhancement. The company's initial focus is developing a neuroprosthesis that can help treat conditions such as depression and anxiety by directly stimulating the brain. Closing thoughts about neural implants. The next decade for neural implants will likely see significant technological advancements. One central area of development is improving the precision and accuracy of implant placement. This can enhance the efficacy and reduce the risk of these devices. Additionally, integrating neural implants with other technologies such as virtual reality could lead to exciting new possibilities for treating and enhancing human cognitive function. The next decade for neural implants will likely see significant progress in the technology and its applications in treating a wide range of neurological and cognitive conditions. This is all about neural implants. This is all I wanted to share about brain surgery. Thank you so much. Allah Hafiz.